Ulcers, symptoms and signs, diagnosis and treatment. Your stomach is a tube that connects your esophagus to your small intestine. It is here where protein digestion begins. The stomach performs three functions. It keeps food that has been swallowed, it incorporates gastric acids into the meal, the combination is then sent to the small intestine. Hey everybody, welcome to Boost Healthy, the video channel to live healthier and better. Most people suffer stomach issues at some point in their lives. Heartburn and indigestion are typical issues. Over-the-counter drugs and lifestyle modifications, such as limiting fatty meals or eating more slowly, can help ease some stomach troubles. Other problems, such as peptic ulcers or GERD, necessitate medical treatment. Let us have a quick and descriptive discussion about gastric ulcers. But before we begin, please subscribe to our channel for more great health and fitness videos. Remember to click the like button. What are ulcers? Ulcers are lesions on the stomach or small intestine lining. It's also possible to have sores on your esophagus, throat. The majority of ulcers occur in the small intestine. Duodenal ulcers are the name for these ulcers. Gastric ulcers are a type of stomach ulcer. Esophageal ulcers are sores in the throat. Those occur when the protective layer of mucus in your digestive tract is etched away by stomach acids. You may or may not experience any symptoms, or you may experience discomfort or burning pain. Internal bleeding caused by peptic ulcers can result in the need for blood transfusions in the hospital. What are the symptoms? You'll probably feel a scorching sensation or discomfort between your belly button and breastbone. You may sense it more on an empty stomach, such as between meals or at night. If you eat or take an antacid, the pain may subside for a short while, returning it. The discomfort can last anywhere from a few minutes to several hours, and it might linger for days or weeks. The most frequent sign of a peptic ulcer is burning stomach discomfort. Stomach acid, as well as having an empty stomach, aggravates the pain. Eat some meals that buffer the stomach acid or take an acid-reducing medication to alleviate the pain, but it may return. The discomfort may be worse between meals and at night. Other symptoms include discomfort in the middle of the night or between meals, duodenal ulcer. When you eat or drink, you feel uneasy, gastric ulcer. You wake up in the middle of the night with stomach agony, feeling stuffed, stomach bloating, burning, or a dull ache. For days or weeks at a time, he comes and disappears. The soreness can last anywhere from a few minutes to several hours. Your ulcer becomes a bleeding ulcer if it becomes perforated, torn. The following symptoms may occur as a result of this: nausea, blood in the vomit, unexpected weight loss, feces with blood in them or stools that are dark in color, your back hurts. If you have any of these symptoms, you might want to see a doctor ASAP. What causes an ulcer? Helicobacter pylori are the most common cause of stomach ulcers, H. pylori. This is the result of a bacterial infection. Acids in our food might exacerbate the pain and suffering. Ulcers can also be caused by the long-term use of aspirin or anti-inflammatory drugs, ibuprofen. An ulcer can be aggravated by stress and spicy foods. So, the two major causes of ulcers are bacteria, certain pain relievers, smoking cigarettes, and drinking alcohol. Bacteria. Helicobacter pylori, H. pylori, is a bacteria found in the stomachs of up to half of the population. The majority of persons who are infected with H. pylori do not develop ulcers. However, it can increase acid production, break down the protective mucus layer, and irritate the digestive tract in some people. The exact mechanism by which H. pylori infection spreads is unknown. They believe it can be passed from one person via close contacts, such as kissing. It can also be contracted by contaminated food and water. Certain pain relievers. You're more prone to develop a peptic ulcer if you take aspirin frequently and for longer. Other non-steroidal anti-inflammatory medications are in the same boat, NSAIDs. Ibuprofen and naproxen are two of them. NSAIDs prevent your body from producing a substance that protects your stomach and small intestine from stomach acid. Other pain relievers such as acetaminophen will not cause peptic ulcers. Smoking cigarettes and drinking alcohol. You're more prone to have ulcers if you smoke cigarettes or drink alcohol. Experts once believed that stress and consuming a lot of spicy food caused ulcers. However, they have the potential to aggravate ulcers and make treatment more difficult. How is an ulcer diagnosed? Your physician will inquire about your symptoms. They might perform an endoscopy. A tiny, flexible tube attached to a camera is inserted down your throat and into your stomach during this treatment. H. pylori will be detected in your blood, breath, or stool by your doctor. A sample of your stomach lining can also be tested. Your doctor will also inquire about your use of aspirin or anti-inflammatory medications daily. If your symptoms are severe, your doctor may suggest an upper endoscopy to see if you have an ulcer. The doctor uses an endoscope, a short illuminated tube with a tiny camera, to examine for abnormalities in your throat and stomach during this treatment. H. pylori tests are now commonly available, and your doctor will design a treatment plan to alleviate your symptoms while also killing the bacteria. The quickest way to find out if you have H. pylori is to do a breath test. A blood or stool test or a sample taken during an upper endoscopy can also be used to check for it. An ulcer induced by an H. pylori infection cannot be avoided. However, reducing aspirin and anti-inflammatory medications can help lower your risk. To alleviate discomfort, avoid acidic, orange juice, and spicy foods. Caffeine and alcohol should be avoided. Ulcer treatment. To treat an H. pylori infection, your doctor will prescribe antibiotics. You'll need to take it for 2 to 3 weeks. Your doctor may also recommend triple therapy. This is a drug that combines 2 antibiotics with a protein pump inhibitor, PPI. Your doctor may recommend medicines to lower stomach acids. You may have to take them for up to 8 weeks. Ulcers can also be treated with a variety of different medications. H2 blockers and PPIs are 2 types of medications that limit the amount of acid produced by your stomach. Over-the-counter antacids provide temporary relief. Smoking and drinking exacerbate the discomfort. In severe circumstances, surgery may be required. Without treatment, ulcers will worsen. Your doctor may recommend misoprostol if aspirin and anti-inflammatory medications hurt your stomach. Your doctor may also prescribe antacids or drugs to reduce the amount of acid produced by your body. Prescription medications known as cytoprotective agents can aid in the healing of an ulcer by protecting the stomach or small intestinal lining. Imaging techniques such as X-rays and CT scans are utilized to detect ulcers less commonly. It would help if you consumed a special liquid covering the digestive tract and allowing imaging devices to see ulcers more clearly. Do ulcers heal on their own? Though ulcers can sometimes heal on their own, the warning symptoms should not be ignored. Ulcers can cause significant health concerns if not treated properly, including bleeding. Perforation is a term used to describe the process of a hole through the stomach wall. Obstruction of the gastric outlet due to edema or scarring prevents food from passing from the stomach to the small intestine. Ulcer prevention. If you use the same procedures that are advised for treating ulcers at home, you may lower your risk of developing a peptic ulcer. It may also be beneficial to protect yourself from infections. Although it's unclear how H. pylori spread, there's evidence that it can be passed from person to person or by food and water. You can protect yourself from illness like H. pylori by washing your hands frequently with soap and water and eating foods that have been thoroughly cooked. Use caution with pain relievers. Take actions to limit your risk of stomach troubles. If you regularly use pain medicines that increase your chance of peptic ulcers, take your medication with food, for example. Work with your doctor to determine the smallest amount that will still provide pain relief. Avoid consuming alcohol because the two can raise your risk of stomach discomfort when taking your prescription. If you need to take an NSAID, you may also need an antacid, a proton pump inhibitor, an acid blocker, or a cytoprotective drug. COX-2 inhibitors are a type of NSAID that may reduce the risk of peptic ulcers, but may raise the risk of a heart attack. Healthy food intake. Probiotic bacteria can be found in foods including yogurt, miso, kimchi, sauerkraut, kombucha, and tempeh. They may aid in the treatment of ulcers by preventing H. pylori infections or enhancing the effectiveness of current treatments. Apples, pears, oats, and other high-fiber meals are beneficial to ulcers in 2 ways. Fiber can help relieve bloating and pain by lowering the amount of acid in your stomach. A high-fiber diet has also been demonstrated to help prevent ulcers in studies. Vitamin C-rich red peppers can help prevent ulcers in a variety of ways. Vitamin C, for example, is necessary for wound healing. Ulcers are more common in people who don't get enough of it. Citrus fruits, strawberries, kiwis, and broccoli are also good sources of this vitamin. To heal ulcers, doctors also used to advise patients to consume milk. That was before newer treatments, such as acid-blocking medications, became available. We know now that milk will not prevent or relieve an ulcer. In fact, it may aggravate the situation by causing your stomach to produce more acid. That's all from today's video. Hope you enjoyed it. Let us know in the comments section if this guide was helpful. Subscribe and turn on notifications so you don't miss more interesting health videos and much more. Check out this playlist of latest uploads, and I'll see you in the next video. Take care.